Welcome to Quaderno Academy, empowering excellence through education. Join us as we inspire growth and unleash your potential. Let's dive in.
All right, so today we're going to tackle a massive question in healthcare. I'm talking about a problem that costs hundreds of millions of dollars, and that's just the start. More importantly, it impacts real people, real lives. But here's the thing. Hidden inside this giant challenge is a pretty simple idea that could, well, change everything. So let's get into it.
It all kicks off with this quote. You know, when we're staring down something that just feels huge, intimidating, maybe even impossible to solve, what's our first reaction? For a lot of us, it's fear, right? Or anxiety. But this quote pushes us to ask, what if we chose curiosity instead? What if that was our superpower? So, to make this idea real, picture this. Our source tells this great story about being a backcountry skier. They loved being out in the mountains, but they were absolutely terrified of avalanches. I mean, who wouldn't be? But instead of just stopping or letting that fear run the show, they did something different. They got super curious. They took courses, they learned all about snowpack, they figured out how to read the mountain. And that curiosity, it completely flipped the script. It turned that paralyzing fear into real, informed confidence. It's the perfect way to frame the much bigger challenge we're about to dig into.
Okay, so let's take that mindset, that idea of swapping fear for curiosity, and apply it to something even bigger, a system that touches every single one of us, healthcare. Because believe me, it has its own kind of avalanche just waiting to happen.
So here's the deal. We've got what people are calling a silver tsunami. Basically, a whole lot of us are getting older. And the Medicare Trust Fund, the thing that pays for a huge chunk of that care, it's running out, and fast. The way we've always done things, just paying for every single service, every test, well, it's just not working anymore. It's totally unsustainable. And that means something big has to change. And if you want to understand just how big of a deal this is, just look at this number. $317 million. That's not for the whole country. That's the cost of preventable hospital readmissions for one single healthcare organization in just 1 year. Think about that. It comes from over 21,000 people being sent back to the hospital, and each one of those trips costs about 15 grand. It is just a mind-boggling amount of money. But, and this is the really devastating part, this isn't just about the money. Not even close. The human cost is so much higher. For an older person in, say, a rehab facility, every single time they have to be transferred back to the hospital, their risk of dying doubles. Let that sink in. Doubles. So we're not just talking about numbers on a spreadsheet here. We're talking about real, preventable harm to people. Okay, so this is where that idea of curiosity comes back in. It would be so easy to look at this and just think, well, that's just how it is. It's unavoidable. But it's not. According to Medicare's own data, a whopping 70% of these readmissions are totally preventable. 70%. That's the key. This isn't some unsolvable crisis. It's a solvable problem. We just have to figure out how.
All right, so if the old pay-for-every-service model is broken, what do we do instead? Well, this leads us to a really fundamental shift in how we approach healthcare. It's this thing called value-based care. And honestly, the core idea is pretty simple. Instead of paying for the quantity of care, every test, every procedure, every visit, we start paying for the quality of care. We pay providers based on patient outcomes. How healthy do they keep people? It's a total flip from paying for activity to paying for results. And this isn't some crazy new idea that just popped up yesterday. The folks at Medicare and Medicaid Services, CMS, as you'll hear them called, they've been working on this for more than a decade. You can see on this timeline it's been a slow, steady push, getting hospitals on board, then skilled nursing facilities, gradually holding more and more parts of the system accountable for actual patient outcomes. So, what does value even mean in this context? It's not just some fuzzy idea. It's actually measured by really concrete stuff. Things like, are we preventing readmissions? Are we preventing falls? Is there enough nursing staff? And maybe the most important one, are patients actually getting better and able to go home? This table really, it's like the blueprint for what good, high-quality care is supposed to look like. Okay, so the theory here sounds great, right? Pay for results, not just for doing stuff. Makes sense. But as we all know, making something work in the messy reality of the real world, that's a whole other ballgame. So let's take a look at what happens on the ground. This brings us to this incredible anecdote about a nurse who got the nickname Ship 'em Tippin'. Not a great nickname, right? She was the weekend manager, and it seemed like she was always sending patients back to the hospital. So what was going on? Was she just the bad nurse? Not at all. The problem was the system. When a patient started to decline on a Saturday, she couldn't get a doctor to call her back. So to be safe, her only choice was to ship them out. The system itself was setting her up to fail.
And this comparison here just nails the problem. On the left, you've got the siloed approach, which is way too common. The therapist sees a patient isn't doing well. They mention it in passing to a nurse who is just swamped, juggling a million other things. And that critical piece of information just vanishes. Poof! And what happens? The patient gets worse and ends up back in the hospital. But look at the right side, the collaborative model. Here, the teams are talking, sharing info on purpose, identifying those at-risk patients together so they can step in before it becomes a crisis.
So how do you actually get people to collaborate like that? Well, it doesn't have to be some huge, complicated overhaul. The source has some really practical ideas. Things like a dedicated clinical magic hour, where nursing and therapy just sync up, or inviting a nurse to watch a high-risk therapy session, even just a quick daily stand-up meeting to talk only about the patients who are struggling. These are small, simple shifts that can completely break down those communication silos.
So, let's recap. We've got curiosity, which helps us see the problem clearly. We've got collaboration, which gives us the tools to start fixing it. But there is one more piece of the puzzle, the final, absolutely crucial ingredient that makes any of this actually work.
Check out this story. There was this one facility that had terrible readmission rates, just chronically bad. And internally, they had all the excuses. It was this doctor's fault. Their patients were just sicker than everyone else's. You've heard it before. They were completely stuck. But then an outside agency came in and laid down the law. From now on, they said, you have to justify every single patient you transfer to the hospital.
And would you look at what happened next? The change was absolutely dramatic. As soon as they were forced to look in the mirror, to actually be held accountable for their decisions, their readmission rates plummeted. Suddenly, all those excuses just melted away. It wasn't about the sick patients anymore. It was about their own process. That accountability completely changed the game.
So what this story really gives us is a simple 3-step blueprint for how to make real change happen. Step 1, you have to take a hard, honest look at the facts. No more excuses. Step 2, you use that data to dig deep and find out what's really going wrong, the root cause. And step 3, you build a system that drives accountability so the improvements don't just fade away after a week.
And that brings us right back to where we started. If curiosity is the engine that gets us started on these huge, scary problems, and collaboration is the vehicle that helps us move forward together, then maybe, just maybe, accountability is the fuel. The one thing we've been missing all along to actually solve this $317 million question for good.
Brought to you by Quaderno KO. Learn smarter, not harder.